Good morning.
Good morning, sir.
Yes, so we're meeting once again and for the same discussion, continuing with the discussion on dysfunction of the spinal cord. And these are all the things that we have seen yesterday, isn't it? Today we're going to discuss. Yesterday we discussed the complete transaction. That means a complete division of the spinal cord, and the incomplete where there is major injury to the spinal cord, but then it is not showing complete division. Okay, so as I've said yesterday, we can have injuries, all right, of the spinal cord at different places of the spinal cord. So here we're just looking at the overview of number of diseases that can or conditions that can cause injury or dysfunction of the spinal cord. Okay, so when you look at this slide here, I mean you see a number of conditions. The first one is poliomyelitis. The virus which is causing poliomyelitis is affecting this part of the gray horn, isn't it? The anterior horn, and affecting the lower motor neuron. So it's a lower motor neuron lesion. It's showing lower motor neuron lesion. Okay, manifesting flaccid paralysis. So in case of poliomyelitis, this is where you see these. This is where it will be the site of lesion. Then something like amyotrophic lateral sclerosis, you will find lesions here and here, affecting not only the cells but affecting the tracts as well. You see. So that's why we are, getting manifestation in, that are both the upper and lower motor neuron type. Okay. See, usually when the cells are affected, okay, it's going to show lower motor neuron type. When the cords, when the tracts are affected, it will be manifesting upper motor neuron lesion. Okay. And in complete occlusion of the anterior spinal artery, you look at this. This is where dominantly involving the white matter, okay, and involving the intermediate part of the posterior tracts, the anterior, pathways, lateral pathways, posterior pathways, isn't it? And multiple sclerosis affecting the posterior column, all right, and the anterior. Okay, so random asymmetric lesions of the white matter, usually in cervical area. This happens in the cervical area, leading to scanning speech, tremor, and nystagmus. So these are a few things that you can remember with regards to multiple sclerosis. Tabes dorsalis is sometimes comes as a question. Here, the injury is the involving the posterior root. Okay, it sometimes involve only the posterior root, the lateral part of the posterior root, and may not involve the ganglion, may or may not involve the ganglia, and this kind of injury of the posterior roots, nerve roots, is seen in the conditions of neurosyphilis. All right, we have a bacteria that is causing neurosyphilis. I think it's Treponema pallidum. This bacteria. It's a kind of a sexual transmitted disease. Okay, neurosyphilis, and it is causing injury to the posterior root, nerve root. So what is happening here is that it is involving the, as you can see, part of the posterior horn as well, posterior root, and there will be loss of all sensations. And initially, there would be some kind of exaggerated pain sensation. Sometimes, this kind of pain is called as a shooting pain. Okay, but then eventually with time, even that sensation of pain will be lost. So sensation of all, senses, of all sensations would be lost. Okay, so, and this is a very gravest thing, because you affect the posterior, you affect the, when the sensory fibers are affected, then even the reflex arc would be affected, because there would be no impulses coming from the external environment to the cell here, the motor cell here, and then so tone as well will be lost. Okay, so the the reflex arc is becoming incomplete. Okay, you always need these impulses coming from here so as to maintain some kind of tone in the muscle. That is not then a condition like this would even affect the bladder, the urinary bladder. It can result in something like an atonic bladder, as I said. Okay, so bladder is not feeling the filling of itself. All right, because stretch receptors are not. It's not that the stretch receptors are not working, but then the nerve roots, the afferent nerves, they are because of injury, they are in there's an inability to transmit the impulse. So the afferent fiber is degenerated as a result of neurosyphilis, or it can be conditions that may cause demyelination of this as well. So as for that reason, that tone is not maintained, and therefore you get kind of an atonic bladder in case of urinary bladder, resulting in what we call as incontinence, what we call as overflow, dribbling, micturition, which there is no complete micturiation, but the bladder is always full, but then there would be only dribbling of the urine. Okay, so anyway, that is one of the symptoms of signs and symptoms of tabes dorsalis. But then you have others as well. The joints will be affected, and as a result of affection of the proprioceptors. Okay, so again, there's actually the nerve roots, the degeneration of the posterior nerve roots, which is actually causing the inability to sense the joint. So person cannot perform normal gait. So when he walks like a drunken. He manifests a kind of a drunken gait, something called as ataxia. But then here, the type of gait that you see here is not drunken. It's it's said to be a stomping gait. So the limbs are when they perform movement, the movement becomes exaggerated. Okay, if one walks, he lifts high up, all right, and then stomp the ground. Okay, so that's why this type of gait is called a stomping gait. Okay, so you see stomping gait in the tabes dorsalis. That will be mentioned. Will be mentioned when we study the gait. All right, the different types of gait in different types of conditions. Okay, and this is one type of gait. It's called as stomping gait. All right, and then you get something like inflammation of the joints, which we call as the Charcot's joint, and these are some of the features of tabes dorsalis. Okay, so destruction of the fibers at the posterior root, especially the thoracic and lumbosacral regions. So it's going to affect this region mostly. Okay, and causing stabbing pain or something called as shooting pain, paresthesias, that means loss of normal sensation, and loss of pain sensation, and ataxia. Actually, it's not the pain sensation alone that is affected, but then other sensations as well are affected. Okay, now you may see this type of injury in dysfunction, spinal dysfunction in vitamin B12 deficiency, or you get something called as a Friedreich ataxia. Here there will be demyelination of the dorsal column, and lateral corticospinal tracts will also be involved, and as well as the spinocerebellar tracts, resulting in this ataxia, leading to ataxia. There would be hyperreflexia, impaired position and vibration sensation. Okay, so these are. Then I come to syringomyelia, and syringo is actually a term that means cavity. So when you say syring, it refers to a cavity. Okay. So syringomyelia, that means cavity in the gray horn, in the gray matter. Okay. So damage will be to the crossing fibers of the spinothalamic tract, causing bilateral loss of pain and temperature sensation. So you see, what is happening here is that the lesion is somewhere around the central canal. Okay, but sometimes it does not become restricted to the gray matter alone, but it may involve the white matter as well. Okay, anyway, what is happening here is that because it's involving this central part of the gray matter, it'll be affecting the tracts, sending tracts that are crossing through the anterior part of this the anterior, what we call as the antirectometers. So this part will be affected. All right. That means fibers crossing to the opposite side. All right, will be affected. And these fibers across are fibers that carry the pain and temperature sensation. Pain, temperature, crude touch. Okay, these are the fibers that will be affected. So that is why we'll have lots of pain sensation, temperature sensation as a result of what we call as syringomyelia. So in syringomyelia, what is happening is that there is sometimes overgrowth of neuroglias and formation of cavities here. All right, cavity which may enlarge, involving not only the gray matter but the white matter as well. So it may, you may have some kind of because it's going to affect the tracts. All right, so you may have some features of upper motor neuron lesion in case of if the tracts are involved. Okay, and it may, if it continues to grow larger and larger, that it may involve the posterior part, involving the posterior column, and depending how the degree of the enlargement of this lesion around the central canal. So that will be the features that you will be seeing. So syringomyelia may come as a question. Okay, it's you never know. But these are too common. Indeed, syringomyelia and tabes dorsalis is something that you must, and multiple sclerosis is something that you must, learn. And it's good to know what happens in, vitamin B12 deficiency. These are all just a lack of this particular vitamin. That this can also cause pernicious anemia, but that it can also cause this type of problem. Okay, affecting the nerves. Okay, and resulting in this form of, abnormal gait, abnormal, walking, nature of walking. Okay. Anyway, so this is with respect to syringomyelia. Now the complete cord transaction we have already discussed, involving the entire cord, or it may, spare some parts and, result in what we call as an incomplete cord transaction, or what we call as incomplete spinal transaction, which we had discussed yesterday. Now there is another thing that that we also need to look into a little bit more in detail, and that is the hemisection of the spinal cord. That means when only one side of the spinal cord is affected. It can be as a result of all those causative factors that I had spoken of yesterday. All right, and but then affecting only one side of the spinal cord. Okay, so this kind of whatever we see, all the features that we see in this type of lesion of the spinal cord, all the dysfunction, all right, dysfunctional features, all those are clubbed into what we call as a Bronson Cut Syndrome. Okay, so it's a kind of incomplete sound case. It's just like a type of incomplete spinal cord lesion, all right, and resulting in upper motor neuron paralysis, loss of proprioception, contralateral loss of pain, and temperature sensation. But anyway, we have to see, in a little, in a detailed manner with regards to Bronson Cut Syndrome, because it's an often asked, question. Okay, and it's something that we must know, So anyway, we have. Before I come to Bronson Cut Syndrome, let us look at these, different the involvement of different parts of the spinal cord. Some involvement of the entire interior. So this is a kind of hemisection again. Okay, it's just the anterior part, right, which is involved here. Anterior cord syndrome, complete motor paralysis because it involves the anterior horn and of course the white matter, and of course loss of pain and temporal sensation because these fibers in the anterior spinal thalamic tract, okay, they will be involved, and position and vibration sense is preserved because this is preserved. This is the area through which the pathway carrying fine touch, what we call as tactile discrimination, tactile localization, vibration, position, stereognosis. This is the part that is involving in carrying all those sensations. So that part is preserved. So this can be associated with severe flexion injury. Okay, so these are, I'm just showing this, but you're not, this is something that is not even there in your book. Okay, you can have posterior cord syndrome. I'm just showing you that you can have different types of injury to the spinal cord. So it can be a posterior cord syndrome involving this the white matter alone in the posterior part of the spinal cord. And so here what happens, because we have the dorsal column ascending through this, all right, so what happens is that we will be losing all those sensation of fine touch, tactile localization, tactile discrimination, isn't it, vibration sensation, isn't it, stereognosis, all right, those are things that proprioception, all right, those are the things that will be lost, sensation of those things will be lost. Okay, motor function is preserved because of course this mostly the white matter carrying all motor tracts is being preserved, and the horned gray matter is also being preserved. Okay, so it can be, the cause can be many. Okay, can be injury, can be compression, and a space occupying lesion. All right, so we come to central cord syndrome, something like syringomyelia. Okay, so if there's a small lesion, then pain and temperature sense lost, and to some extent vibration and position sense lost. If it is like, see, if the injury, it is crossing the gray matter and involving some portion of the posterior white matter. Okay, so then vibration and position sense loss also will be seen, and then some amount of motor loss because it involves the anterior. It may it may cross, this lesion may cross to the extend to the anterior horn cell. Okay, then if it is the lesion is if it's more extensive, then many other things would be, if it's a large lesion around the central cord, then you probably have you'll have many features and many signs and symptoms, and because many tracts would be involved, many cells would be involved, isn't it? So it would be involving the posterior column, would be involving the lateral corticospinal tracts, the horn cells, anterior horn cells, motor cells here, then the pain temperature pathways, all right, the commissure, anterior commissure. So it can manifest a host of signs and symptoms or features. Okay, and we come to Bronson Cut Syndrome, all right, which can be considered as an incomplete transection cord injury or a hemisection, we can say. Okay, so what do we see here? We have just probably one half of the spinal cord that is damaged. The other half is intact. All right. So what do we see here? You will have at the level of the lesion manifestation, below the level of the lesion manifestations. Okay. So if you look at below the level of the injury, all right, then what can be the features? Let us look at sensation. Okay, so what is happening is that the cross fibers will be affected. All right, sorry, on the same side. Let's take first on the same side or on the opposite side. Okay, so on the same side, what will happen? Same side of the injury. On the same side of the injury, you will have it will affect the sensation of fine touch, isn't it? And tactile localization, tactile discrimination, stereognosis, all those sensations would be lost. But then it will not affect the pathway carrying pain and temperature sensations. But then when you look at the opposite side, all right, below the level of lesion again, and on the opposite side, you would find that because the fibers from this side, they cross towards the opposite side, towards the injury side, like this. So fibers coming like this, they'll be crossing like this immediately. All right, all the fibers below the level of injury, they'll be crossing like this, and then they will be ascending on this side. But then you have an injury here, so what is happening? Whatever sensation that is coming from here with regards to pain temperature will not be carried to the brain. So even those sensations will be lost. On the opposite side, you'll have loss of pain and temperature sensation. On the same side, what we call is ipsilateral sensation would be the loss of fine touch, isn't it? Tactile localization, vibration sensation, tactile discrimination, stereognosis. Okay, all right. These are the things that you will be lost. Okay. What about the motor deficit? Motor deficit will be similar to what we call as the upper motor neuron lesion. Okay, right? Will be an upper motor neuron type of lesion. Okay, so normally affecting the injured site, but then some motor tracts they also cross, so you'd find that mild form of paralysis would be also seen on the opposite side. Okay, clear. Now, what will happen? What will happen at the level of the injury at this point? All right, at this point, if it is at this point, what can be the effect on the sensation and motor function? So at this particular point, the level of lesion, you'll find that the posterior root is completely injured, and because of that you will find that all sensation will be lost. Something called as a complete anesthesia. All right, so and complete loss of all sensation. All right, so will be occurring at the level of lesion. Fine. And you would see, what about motor deficit? You would see a lower motor neuron deficit at this level. Okay, a lower motor neuron deficit. Fine. So on the opposite side, it will be the you will have the loss of pain and temperature, crossed fibers. All right, going like this. Okay, so sensation of those of pain and temperature would be lost. But then what about the motor deficit? It's going to be mild form of lower motor neuron lesion. Okay, because only probably 20% of the fibers would be crossing, of the descending fibers, the pyramidal tract would be crossing. Okay, and therefore the the effect will be very small. Okay, but then if it's there, it's going to be again low motor neuron type of lesion. Okay, so this is what we call as a Bronson Cut Syndrome. Okay, damage up to one half of the cord on either side. It can happen. It can be many causes, can be many: ischemia, penetrating injury above the lesion. We call as small area of cutaneous hyperesthesia on the same side, no motor involvement on both sides above the lesion. Here it's saying no motor involvement on both sides, but then you'll find that in a number of textbook it will be mentioning about low motor neuron lesion. Okay, and above the lesion you'll not have any motor involvement. I was thinking of at the level of lesion. Okay, so anyway, at the level of lesion, what happens? Complete sensory loss, as I've said, low motor neuron paralysis, vasomotor paralysis, same site. But then, as I've said, some of the fibers they cross, so mild, probably you may see some mild features of low motor neuron paralysis on the other side. So no sensory motor vasomotor involvement on the opposite side as far as this slide is concerned. But then you read in some textbook, you'll have all those things that I've already mentioned. Okay. Below the level of lesion, impairment of ipsilateral light touch. As I've said, the posterior column is is affected. What we call as a dorsal column. Okay. And so there would be loss of all these sensations. And opposite side, impairment of contralateral pain and temperature below the level of vision. That means sensation on the opposite side would be this, the loss of sensation on the opposite side of the body would be pain and temperature. Okay, and of course it will be an upper motor neuron type of paralysis below the level of lesion, and involving both probably both sides. But then the ipsilateral side would be showing strong features of upper motor neuron lesions, but the opposite side would be showing some mild form of paralysis. Okay, yes, so these are all lesions that result in the dysfunction of the spinal cord. Okay, so in these two classes I've been able to discuss about various causes of spinal cord dysfunction and features that you may see in the different types of spinal cord dysfunction. Okay, so it is a very vast topic, but then you need to focus your understanding on a number of them. All right, you may have to read complete transaction. Okay, incomplete transaction, and in Bronson Cut syndrome as one incomplete transaction or hemisection. And some people consider hemisection as not, hemisection as different and cannot be categorized as incomplete cord transaction. Okay, incomplete cord transaction is considered to be separate, not the same as hemisection. Okay, that you will see this kind of opinion you will see that will varying in different textbook. Okay, and what you have to again read will be other injuries of other portions of the spinal cord. For example, the injury of this posterior root, like tabes dorsalis, which is oftenly it's oftenly an asked question, a question that is being asked, and maybe syringomyelia, you should have some idea about it. Okay, and Bronson Cut syndrome. Okay, so read so that whatever you have listened and heard from this class, okay, will be reinforced. Am I clear?
Yes, sir.
Okay, it may sound a little bit complicated, but then the moment, I mean, if you read today, probably you'll find it less complicated. Okay, because with whatever I've explained to you and reinforcing by reading it, you will definitely, comprehend. Okay, the different types of spinal cord dysfunctions. Okay, am I clear?
Yes, sir.
Yes, sir.
Rather, it will be kind of, guiding material for you to read. Okay, but I think you don't have to, go too much into the detail of all these things. Whatever I've given in the slide here, it'll be more than sufficient for you. Okay, of course, you have to, put some addition from, here and there from the textbook. Okay, about some of the, for example, Bronson Cut syndrome. Probably you'll have to even refer to the textbook. Whatever is given here is not enough. Okay, so I have probably discussed in detail about Bronson Cut syndrome, though the slides is not giving the details about it. Okay, clear? Is it clear?
Yes,
Hello?
sir.
Yes, sir.
Okay, okay then. Bye.
Bye, sir.